Have you ever seen someone laugh at the worst possible moment or suddenly start crying, even though nothing around them feels sad? At first, it looks confusing, maybe even inappropriate, but for some people, this isn't a choice or a personality trait. It's a neurological condition called pseudobulbar affect, and it causes emotions for it to go out of sync. Normally, your brain has a system that keeps your emotions in balance. What you feel on the inside is matched by how you express it on the outside. If something is funny, you laugh. If something is sad, you cry. That system depends on communication between different parts of your brain, especially areas like the frontal lobe, which helps control behavior and responses, and deeper regions that generate emotional signals. These parts are connected by neural pathways that act like a control network. But in pseudobulbar affect, that network gets disrupted. Not because of genetics, and not because someone is born this way. Most of the time, PBA develops after damage to the brain. This can happen due to conditions like stroke, traumatic brain injury, multiple sclerosis, or ALS. When these conditions affect the pathways that regulate emotional expression, the brain loses its ability to properly control those reactions. Think of it like this: your emotions are the message. Your brain is supposed to deliver that message accurately, but in PBA, the delivery system is damaged, so the reaction comes out exaggerated or completely mismatched. Someone might feel only slightly amused, but start laughing uncontrollably, or feel neutral and suddenly begin crying, not because they want to, but because their brain can't regulate the signal anymore. And here's what makes it even harder. From the outside, it doesn't look neurological. It looks like behavior. So people often assume they're being dramatic. They're overreacting. They're not taking things seriously. But in reality, many people with PBA feel embarrassed, confused, and even frustrated with themselves because they know their reaction doesn't match how they feel. They just can't stop it. These episodes are usually sudden. They can last seconds to a few minutes and then disappear. And in between episodes, the person's emotional state is completely normal. Now, it's also important to understand this. Pseudobulbar affect is not the same as depression. Depression affects your overall mood over time. PBA affects how emotions are expressed in short bursts, so someone with PBA might cry without actually feeling sad. That difference is really important because it changes how it should be treated. So, can pseudobulbar affect be treated? Yes. In many cases, symptoms can be reduced significantly. There are specific medications that help regulate the brain signals involved in emotional expression. Some people also benefit from certain antidepressants, not because they're depressed, but because these medications can help stabilize emotional responses. But here's something you need to understand clearly. PBA should never be self-diagnosed or self-treated, because it's usually linked to an underlying neurological condition. Any treatment needs to be done under proper medical supervision. A doctor needs to evaluate the cause, confirm the diagnosis, and decide what's safe and appropriate. In some cases, symptoms can improve a lot. In others, they can be managed, but not completely removed. It depends on the underlying brain condition, which is why awareness matters so much, because when people understand what PBA actually is, they stop judging the reaction and start understanding the person. So the next time you see someone react in a way that doesn't quite match the moment, pause before you assume, because sometimes it's not the emotion that's unusual, it's the signal behind it. If this helped you understand something you didn't know before, let me know in the comments. And if you want more simple explanations of how the mind works, subscribe and like the video, because sometimes just understanding makes people a little easier to be around.